Hello and welcome to the Oakley School. Today we will take a couple of moments to complete the documentation of orientation. This orientation is to be conducted prior to assignment to children or task and to be placed in your employee file. Take a moment and write your name and today's date on the top of the form. Each classroom has an orange manual. In that classroom manual, you will find 8 different sections. The very first section has a copy of our facilities, policies, and procedures. We will go through all of these policies and procedures as a part of the onboarding process. However, if you have any questions, concerns, or you're interested in learning more about a specific policy or procedure, please take a moment and review those at your leisure. You will also be asked to complete a staff orientation checklist to show that you have reviewed all of the policies and procedures. Please take a moment and check off the box to indicate that you are aware of where to find the facilities, policies, and procedures. Review of state health and safety requirements regarding number 1, operations, health, safety activities. Our goal is to promote physical activity, build self-esteem, offer a child-friendly, child choice environment where we are motivating children to reach their fullest potential. Each one of our classrooms contains student files in a container to help you to become more familiar with each child and the areas of development that we are working on promoting. We do ask that in the classroom you are using active supervision, moving eyes and moving feet, that you're listening and you're aware of where your students are at all times, that you are using the attendance roster in the Brightwheel app and you're aware of your head count at all times, and that periodically throughout the day, especially as you transition from one area or activity to another, that you are completing head counts and you're aware of how many students are in your care at all times. Number 2, physical environment and equipment. We ask that in order to provide a healthy and safe environment, that you are cleaning up the area and returning it to the original condition. That if you find any item is damaged or broken, you send a message immediately using the Brightwheel to administration, alerting them that something has been damaged or broken and asking that it's picked up. If it's an imminent danger, we ask that you put that item in the hallway and we will remove it from the hallway. Number 3, emergency situations. In the event of an emergency situation, we will notify all staff members using our electronic means. We have a walkie-talkie inside of each classroom. Your walkie-talkie should be on station 1. And if you decide to send a message or we're sending a message to you, you will press this button on the left side. We also use our Brightwheel app to send messages in the event that you're unable to get to the walkie-talkie. For intruder alerts, we do use a code, lunch is going to be late. This will be said directly over the walkie-talkie. If ever in our program, lunch is going to be late, we will send a message on Brightwheel. But again, if you hear the code, lunch is going to be late, we ask that you go in lockdown mode, that you lock the doors, that you cover the windows, and that you and the children in the classroom get into an area where you're not visible by any intruder that may have entered our building. We will say all clear on the walkie-talkie once the situation has been remedied. Number 4, food service and nutrition. We provide breakfast, lunch, and snack. We are sponsored by the Child and Adult Care Food Program, and we must follow specific procedures in serving breakfast, lunch, and snack. Students must receive the entire meal as one full at the same time. So for example, for breakfast, they must receive their milk along with their breakfast plate. For lunch, they must receive their milk along with their lunch plate. We may not withhold any food items in the event that a child may spill it. We must provide the entire meals. Breakfast is served from 8:30 a.m. to 8:45 a.m. for all students. At 8:40, any student coming in after 8:45 has missed breakfast and will not be able to be served. Students with any allergies or any food allergies will be noted in our Brightwell app. There will be a red asterisk near their names. There is also a food allergy list that's posted in each classroom that has the name of the student and whatever their food allergies are. We do have students that are served different types of milk, so we want you to be mindful of the item that's being served. All meals served must be input in the Brightwell app. Employees assigned duties and responsibilities. Take a moment and review the teacher job description so that you're familiar with your assigned duties and responsibilities. Reporting requirements for number 1, suspected child abuse, neglect, or deprived. As an early childhood educator, you are a mandated reporter. Our procedures for reporting suspected child abuse, neglect, or deprivation are as follows. If you suspect that any child is being abused, neglected, or deprived, you are to report that to the head of school. Please give us no more than 2 hours. During that time, we will try to figure out if a complaint needs to be filed with the local DFACS. After 2 hours, you will return to the individual that you reported to and ask if they will be filing a complaint. If the answer is no, you may respectfully say that you feel that this child is being abused, neglected, and deprived, and as a mandated reporter, you will make the call to DFACS. This helps us to be aware that a DFACS consultant will be out in our environment to conduct an investigation. Reporting requirements for communicable diseases. Any student with any signs of an illness is to be reported in the Brightwell app. You are also to alert management. Students with a temperature of 98.9 or higher, an undiagnosed rash, 1 episode of diarrhea, 1 episode of vomiting, or general signs of lethargy are to be sent home. Students must remain at home for a minimum of 24 hours or until they are symptom-free. We also exclude children with a constant runny nose or a cough. Serious injuries. Any student that is injured within your care, even if they don't have a bump, bruise, scrape, or scar, should be notated in the Brightwell app. Simply click on Incident and you will write exactly what happened. For example, Johnny fell while playing outdoors and hit his knee. There is no bump or bruise. If there is a bump or bruise, you will put example, Johnny fell outside and hit his knee. There is a scrape. The scrape was cleaned and bandaged. This message will be sent directly to the parent. If the parent comes in the following day and notifies you that Johnny had to be seen by a medical professional, you are to alert management so that we may make a formal report to Bright from the start. Number 4, missing children. When doing your head counts throughout the day, if you find that you are missing a student, so for example, you are supposed to have 8 students and you only see 7, immediately grab your walkie-talkie, ensure that it is on station 1, press the button on the left side and say, Burr Oak needs assistance immediately. Again, press the button on the left side and say, Burr Oak needs assistance immediately. A member of management will come and help to look for this missing student. Emergency weather plans. We do follow Fayette County's inclement weather policy. In the event of inclement weather during the school hours, we will alert staff and we will make arrangements to help to evacuate our building. If it's after hours, we will use the Remind app to alert staff of any closures or late openings. Childhood injury control. To control injuries in our early childhood environment, we ask that you are actively supervising. This means that you are present in the environment in which you're working. You're moving around, you're interacting with the students, and you're aware of where they are and what they're doing at all times. Administration of medication. Medication is only administered by members of management. We only administer life-sustaining medication. If a student is administered medication, we will let you know the time to bring the student to the classroom, to the office to receive medication. Reducing the risk of sudden infant death syndrome. To reduce the risk of SIDS, we ensure that in our infant classroom, we use tight-fitting sheets. We're placing every infant asleep on their back, and we are not providing them with any toys, blankets, or anything to play with. In the event that their pacifier falls out of their mouths and they are asleep, do not reinsert. Hand washing. Hand washing is the #1 way to prevent the spread of germs. We ask that you wash your hands appropriately at the appropriate times. Appropriate hand washing includes wetting your hands, applying soap, rubbing for 20 to 30 seconds outside of the water. Ensure that you're lathering the front and the back of your hands and you're washing in between your fingers. Rinse your hands, dry your hands with a paper towel, and turn off the water with a paper towel. Hands are to be washed upon entry into the classroom by every adult and child. Before and after diaper changes, before and after meals, after coming into contact with any bodily fluids, after returning from outdoor play, and after messy play. Messy play includes sand play or art activities. Fire safety. We conduct a fire drill every month. Our goal is to exit within 2 minutes. Depending upon the classroom in which you are assigned, an emergency evacuation sheet has been posted. You will be shown the emergency route that you are to take. Again, our goal is to exit within 2 minutes, as research shows that that's the time that students will suffer from smoke inhalation. After exiting, we will meet on the side gate. An administrator will come out and ask how many students are in your class to do a head count and make sure everyone is present and accounted for. Water safety. Whenever you are engaging in water play, ensure that you are within arm's reach of children. It only takes an inch of water for a tragedy to happen. Prevention of HIV, AIDS, and bloodborne pathogens. To prevent HIV, AIDS, and bloodborne pathogens, we ask that you always wear gloves when coming into contact with bodily fluids. Approved childcare training requirements. Each staff member is to be CPR first aid certified, to complete health and safety orientation, which includes child abuse and neglect, preventing injuries, and child abuse, and health and safety. If you are participating in transportation, you will also be required to complete the transportation training every 2 years. Within our program, we require that every staff member completes 18 hours of training annually. You will be required to create a Georgia PDS account and to update that account with any trainings that have been completed. Cell phone policy. We are a cell phone free environment. You may not have your cell phone in the classroom, in your pockets, or on the playground. Cell phones must be placed away and may not be used during working hours. You have now completed the documentation of orientation. Please take a moment and sign the right side of the bottom of the form where it says signature of employee receiving orientation and put today's date. If you have any questions regarding any of these items, please feel free to speak with a member of management. Thank you.